My name is Federico Cappuzzo. I'm a medical oncologist and I'm the director of medical oncology at the National Cancer Institute Regina Elena in Rome. We are now in Paris and we are just back from some important sessions discussing new data, new finding for patients with lung cancer. So when we look at the overall of the data that were presented, probably one of the most important presentation will be done very soon this afternoon in the Presidential Symposium. These are the results of a clinical trial comparing in patients with KRAS G12C mutation sotorasib versus docetaxel in patients with this kind of mutation in a second-line setting. With the trial, we know that is positive, and this trial certainly will impact in management of patients with relapsed non-small cell lung cancer, specifically for those harboring the G12C KRAS mutation. But during this meeting also we had some other important findings from other trials. Were presented an update on the ADAURA trial, that was the adjuvant trial with osimertinib. So in this update, was confirmed the efficacy in terms of disease-free survival for those patients with resected EGFR mutant non-small cell lung cancer receiving adjuvant osimertinib. But probably one of the most important findings was that the benefit of patients, so the risk of relapse of patients once they stopped the treatment of osimertinib that was given up to 3 years, start to increase. So this is an important message because it suggests at least that the optimal duration of osimertinib should be longer than 3 years. But of course, this is something that will be is important to investigate in additional studies. Then we had other important trials that were presented. One probably of the most relevant was again in osimertinib resistant patients with MET amplification. That was a trial in which was assessed the combination of tepotinib, that is a specific anti-MET inhibitor, together with osimertinib, and the response rate in patients receiving this kind of association was more than 50%. So clearly, this is a very potentially very effective regimen that, again, we need to investigate better in additional trials. Also, we had some other important findings in the early stage disease. In the neoadjuvant setting were presented data of a combination of concomitant immunotherapy, chemotherapy, and radiation therapy, the INCREASE trial. These data were very exciting because in this trial, the complete pathological response was more than 60%, and we know that complete pathological response is probably one of the most important predictor also for long-term survival of the patients. So many important trials, many important data, also update in survival for those patients receiving immunotherapy and chemotherapy in frontline setting. All of these data were presented and confirming the efficacy and the relevance of immunotherapy in treating patients with lung cancer.